Enter the room.
Hello, I'm Dr. Anmali, one of the doctors in the A&E. Are you Sunny Adler?
Yes, doctor.
Okay, how would you like me to call you today?
You can call me Sunny.
Right, Sunny, can you please confirm your age for me?
I'm 55 years old, doctor.
Okay, Sunny, so can I know what brought you in here today?
Doctor, I have been having this pain in my abdomen for the past 6 months, and it's getting worse, so I just came up.
Okay, so you've been having this tummy pain for 6 months. Is it on and off, or has it been there all the time?
It has become constant and more severe, doctor. And yeah.
Okay, do you have any pain right now?
Yes, doctor.
Okay, can you please exactly tell me where in the tummy the pain is?
It is right here, doctor, and it's also going to my back. Yeah.
Okay, right. So what kind of pain is it? Can you describe it? Is like a sharp pain or a dull pain or burning type pain?
It is a little sharp pain, doctor.
Okay, and do you have any vomiting or nausea with it?
Yeah, I feel nauseous, but I didn't vomit.
Okay, any change in your bowel habits?
I noticed my stools have been bulky and full smelling, and it's more difficult to flush since the last 2 or 3 months. So.
Okay. Okay. So, Sunny, you said that it's worse when it goes to your back. Is there anything that makes this pain worse?
Actually, no, I didn't notice.
Okay. Is there anything that makes the pain worse? Sorry, better?
No, not really.
Right. So, Sunny, you said you had this foul-smelling stools and this on pain for 6 months. Other than this, do you have any ongoing fever?
No, doctor.
Okay. Have you noticed any change in your appetite?
Not really.
Okay. Have you noticed that you have lost any weight recently?
No, doctor.
Okay. So, Sunny, I might not say that you're having diabetes mellitus. How long have you been having it?
Sorry, doctor, I couldn't hear you.
They might not say that you're having diabetes. How long have you been having it?
Okay, I had this for the last few years.
And are you on any medications?
Yeah, doctor, I'm taking metformin, 500 milligrams twice a day.
Okay, right. And any other long-term medical problems?
No, doctor.
Okay. So you're on metformin. Anything else? Any other medications?
No, just this.
Okay, all right. Sunny, do you have any allergies to any medications?
No, doctor.
Okay. So I would like to ask a few questions about your lifestyle. Do you take alcohol?
Yeah, I actually drink socially about once a week.
Okay, and can I know how much you usually drink?
2 or 4 bottles of beer.
Okay.
But yesterday I drank a little more, 5, 6 glasses of wine.
All right. Okay. Do you smoke?
No, I do not.
Okay. Sunny, what do you do for a living?
I'm an accountant, doctor.
Okay. And with the pain, how have you been managing your daily life and work?
Okay, actually, I didn't take anything for this.
Okay. All right. So, Sunny, anyone in your family having any medical problems, like any bowel related or any long-term medical problems in the family?
My father had diabetes and nothing else.
Okay, thank you, Sunny, for all the information. Do you have any idea what might be causing this?
I think maybe the pain is because of my diabetes or something I ate.
Okay, right. Any other concerns or any worries?
I just worried if it could be something serious like cancer or complication of my diabetes.
Okay, well, that's fair enough, Sunny. Let's see what we find out from everything. Anything specifically you expect from this visit today?
I hope to get some relief from this pain.
Okay, well, I will definitely help you with that, Sunny. Would you mind if I examine you? I will do the general physical examination, including the blood pressure, pulse rate, temperature, respiratory rate, oxygen level in the blood, and also we'll do tummy examination and do bedside urine dipstick as well. Okay, so
2 minutes remaining.
looks like you have some tenderness in the upper tummy, and I can see that some the test is okay. So, Sunny, from what I have gathered so far, it looks like you are having a condition called acute on chronic pancreatitis. Have you heard of it before?
No, doctor. Is this something related to my diabetes?
Well, it looks like so it has a lot of causes. There's an organ called pancreas in our tummy, which usually produce enzymes to digest our food. So sometimes with diseases like diabetes, there could be some changes happening in this organ. And also sometimes, because you said you've been drinking alcohol and last night you had some more, it could also be have triggered this this episode today. Is that clear to you?
Yes, doctor.
Okay, so what I would suggest is I would like to admit you today, and we will give you pain medications like some strong painkillers like morphine, and for the vomiting as well, vomiting medications, and we'll do some blood tests like full blood count and the basic investigations, including the lipase. And we'll have to do some tests like a scan of the tummy and most likely a CT and an X-ray as well. Is that clear to you so far?
Yeah, doctor.
Okay, so with all the test results, we'll refer you to this gastroenterology specialist, and you might be followed up at the clinic for the pain, and also because you've been having some stool symptoms, I think you're having some problem with that.
Move on to the next station.
Okay, thank you.
Thank you so much. Thank you so much, Dr. Rawali. Thank you so much, Dr. Alp. All right, great job. So this was correct. This was acute on chronic. So, Dr. Rawali, I want to ask you, why did you call it chronic? Like,
Yeah,
what
because
made
he's been having it for 6 months.
Yes, that's right.
And also the malabsorption symptoms.
Absolutely. What is the malabsorption symptom there?
This foul smelling fatty stools.
Absolutely, that's absolutely correct, right? So because lipase is one of the digestive enzymes that is secreted by the pancreas, and because of the pancreas getting destroyed, it's unable to release this anymore, right? And because of which the fat digestion itself is getting affected, because of which you're having this foul smelling floating stools. So good job, right? Good job on understanding that. And he has been having this pain for a while, and all of a sudden it got very severe, right? And from the risk factor point of view, he does consume alcohol, and that is one of the main leading risk factors. So understanding that he has an alcohol intake, bring that back in management. Say that these symptoms that you have been experiencing is because of the destruction of this organ, which is vital to digestion, vital to the food digestion, and it tends to get destroyed, especially with alcohol intake, right? So bring in that fact and give the advice on cutting down alcohol, right? Give the advice for alcohol cessation. Yeah.
Okay.
Yeah. So the other causes that can actually cause this, which is also a lot of leading causes, are, you know, obstruction. So if there are any obstructions to the flow of, you know, the pancreas, to the pancreatic duct, it could be a tumor. It could also be a gallstone, right? So you can ask about the symptoms of, you know, if you've been experiencing any symptoms related to jaundice, right? Any obstructions, then you can actually rule that out as well. Yeah. Awesome. And family history, so good job there. So, right. So I wanted to add a couple of things. So what are you going to do for this patient? What is the immediate management?
Admit.
Definitely. Admit, because this is an acute presentation, right? So because of its acuteness, you have to admit the patient and administer fluid so that the active inflammation comes down. Right now, after you admit, what are the further things that you have to do? You know, apart now, this is acute on chronic. So what is the additional things that you'll have to do? So apparently this patient doesn't even know the fact that he has been suffering from chronic pancreatitis for a while. So what are the other important investigations you need to do and you know, manage? Any idea? Anybody in the call? Anybody wants to add anything? So you need to understand what has been the extent of the damage, you know, the exocrine insufficiency. So accordingly, if there is exocrine insufficiency, accordingly, you will be, you know, replacing the, you know, the digestive enzymes and giving him a replacement for that. Right? Because you have been noticing that, you know, there is a loss of lipase in for the past 2 months. So you will be replacing all that. Right, so a good test for this is called stool elastase. Now, elastase is a compound that you know, gets released from the pancreas and, you know, goes through the digestive system without getting altered at all. So this is something that you actually measure to see how much is the functioning of the pancreas. So this is a good way to measure the function, the exocrine function of the pancreas. So this is the test that they do for that. Right, and also imaging as usual to see the extent of the damage, right? All right, let's take a look at the performance. So Dr. John, were you able to mark? You have to submit it. Were you able to submit?
Yes, I submitted it.
Got it. Thank you so much. All right, let's take a look. So confirm the patient's full name and age. Good job on that. Acknowledge and validate the patient's emotions regarding their symptoms. Ask about the associated symptoms such as nausea. See, you got that he is nauseous, so you can, you know, bring that back in management. You can give him antiemetics, right? So anything that you're asking in data gathering, you know, bring it back in management. Inquire about the recent dietary change or alcohol consumption. Like, why is he having stools? Is it because of the change in diet? Or, you know, is it because of the pancreas, you know? Arrange initial tests such as full blood count, UNE, LFT, CRP, amylase lipase, blood glucose, abdominal ultrasounds, right? Explore the pain using Socrates to cover site, onset, character, associated symptoms and timing, exacerbating or relieving factors and severity. Yeah, okay. Clarify stool changes in details, color, consistency, volume, frequency, floating and presence of undigested food. Yeah, I mean, I think I'll give you marks for that because the main thing that you needed to get from the questions, you kind of got that. So I think I'll give you marks for these two. Inquire about past medical history, especially previous pancreatitis, because, you know, you're suspecting chronic pancreatitis. So has he had these attacks before, or is it the first time, right? Previous pancreatitis, gallstones, hyperlipidemia, diabetes, right? And any abdominal surgeries. Ask about current medication, adherence, and any allergies with the nature of reaction. Perform a focused physical examination, vitals, abdominal examination. Check for jaundice, dehydration, and abdominal tenderness. Yeah. Begin with open-ended question to allow the patient to describe their symptoms in their own words. Yeah, this is something that I would actually highly recommend everybody to start their you know, consultations with. Always ask the questions with an open question, and then close it down so that you can specifically get the answers out of them. But in the beginning, give them an opportunity to express themselves. Ask a question like, I can see from my notes that you have been experiencing some tummy pains. Could you tell me a little bit more about this? So that they can describe it in their own words, right? Screen for red flag symptoms such as severe sudden abdominal pain, confusion, hypertension, and persistent vomiting. I'll give you a partial for this one. All right, management. Explain the diagnosis of acute or chronic pancreatitis in layman terms. Explain the diagnosis of acute or pancreatitis in simple terms, linking symptoms to the inflamed pancreas and its role in digestion and blood sugar control. Yeah, both exocrine and endocrine functions of the pancreas. Start initial management, IV fluid, analgesia, and antiemetics, nil per mouth initially. Order imaging in the form of ultrasound initially, and then CT or MRCP if needed, right? Discuss the initial management plan, including admission and IV fluids. Explain the reason for admission to control pain, give fluids, and prevent complications. Yeah, I think, did you mention the admission part, Dr. Rahmani?
Yes, yeah.
Yeah, I think I'll give you some marks for this one. I think I'll give you full marks on this one. Refer to gastroenterology for cause identification and management of chronic changes. So this is basically a gastro case. So definitely, mention that. Refer to diabetes team for glycemic control and glycemic control review and possible medication adjustment. So let's look at the findings. So we can see that the random blood sugar is also a little bit higher, right? So you need to manage that. Right, so as it is, he's having the normal medication as per advice. On top of that, you're seeing that his glucose is higher. So definitely involve the diabetes team for this as well. Monitor closely regular observation, including vitals, urine output, and oxygen saturation. Insert NG tube if vomiting is persistent. Right. Assess for exocrine pancreatic insufficiency and consider prescribing PER, which is pancreatic enzyme replacement therapy, such as Creon. Lifestyle advice: strict alcohol abstinence, healthy diet, adherence to diabetes management. Yeah, this is very important because this is how you're going to prevent any more triggers, right? Refer to a dietitian for nutritional support. Safety netting: advice to return immediately if fever, worsening abdominal pain, jaundice, or vomiting develops. Arrange follow-up for diabetic nurse input for educational and monitoring. Provide patient education on pancreatitis, managing diabetes, and abstinence from alcohol. Yeah, this is the leaflets bit. Right? You try to include that in every one of your consultation, especially by the time 2 minutes bells rings. Try to wrap it up with safety netting, leaflets, and follow-up. And finally, interpersonal skills: signpost during the consultation to keep the patient informed about the next. Ensure the patient understands the information provided and check for any questions or concerns. Avoid medical jargon, keeping explanation in everyday language. Provide reassurance support to elevate the patient's anxiety. Use sensitive and empathetic language throughout the consultation. Maintain a patient-centered approach, adapting the discussion to the patient's belief, preferences, and priorities. Awesome.
To practice this case with AI, please visit TuringMedSchool.com.